Hello, everybody, and thank you for joining us today. Today, we will be presenting a webinar on evidence-based tobacco cessation programs, 10 successful steps for a successful quit. And this webinar is presented by the National Center for Health and Public Housing. Before we continue, I'd like to welcome everybody and also thank everybody who is joining us today. We hope that the information that will be presented to you all is going to be of great use for your health centers or your organization. And this is just also a kind of reminder that all participants are muted upon entry. Please make sure that you also engage in the chat if you have any questions or any promising practices that you would like to share with us related to today's topic. This meeting is also being recorded, and the slides and recording link will be sent to you all via email after today's session. And just to get sorry, my apologies. And then just to get like a good understanding about who is joining us today, we would like to ask the audience if you can provide your name, your title, and the name of the organization that you're joining us from in the chat. Thank you so much. And then here we have some background information about the National Center for Health and Public Housing. The mission of the National Center for Health and Public Housing is to strengthen the capacity of public housing primary care grantees and other health center grantees by providing training and a range of technical assistance. And CHPH is also a project supported by the Health Resources and Services Administration and is a national training and technical assistance partner that is 100% financed by this grant. The information presented today are those of the author only. Thank you, everyone. I can already see that we have some names being put in the chat. Welcome, everyone. And here we have some information about ourselves. So my name is Fide Pineda Sandoval, and I am the TTA manager here at NCHPH. I will be helping facilitate today's webinar. And then with us, we also have Dr. Jose Leon, who is our Chief Medical Officer at NCHPH. He will be providing some background information about PHPCs and residents of public housing. And lastly, we will also be hearing from Frank Vitale, who is the National Director of the Pharmacy Partnership for Tobacco Cessation, and is also a clinical assistant professor at Purdue University College of Pharmacy. And then without further ado, I'm going to pass it on to Dr. Jose Leon, who will be presenting on the next topic.
Thank you, Fide. Good afternoon or good morning to you, depending on where you are in the country. It's a great pleasure to have you all attending this important webinar. And I am very pleased to have our speaker, Frank Vitale, who has dedicated almost his entire professional life to this particular topic. Before we get started, just some quick information about the health centers close to public housing. Out of the 1,300 plus health centers across the nation, 483 reported to be in or immediately accessible to public housing in 2022. 100 of these health centers, 107, are public housing primary care grantees, which means that they receive funds from HRSA to provide services to this population. And in the same year, they almost serve 1 million patients. Next slide, please. Next slide. So, in case you are not familiar with public housing demographics, there are around 1.5 million residents living in public housing developments. The average people per household is about 2 people or about 2 persons, and is interesting to see that 38% of the households are reporting to have a person with a disability. 26% of them are Hispanic. 19% of this population, they are over the age of 60, over the age of 65. 36% of the household also report to have children under the age of 18. 43% of the populations are African American, and 91% are low income. This is really important to understand all these social determinants of health and demographics. So and to keep in mind that these populations are more likely to have chronic medical conditions as well as being current smokers. Next slide, please. So in the same year, and this is UDS data, this is numbers reported by all health centers in the United States. And you see that all health centers, the 1,300 plus health centers that we mentioned, assessed tobacco use and provided interventions to almost the 85% of the entire population that they serve in 2022. Next slide, please. HRSA recently released a survey. They call it the 2022 Health Center Patient Survey. And patients were asked about different chronic conditions, mental health issues, and other high-risk conditions that they have. And then one of the question was whether or not they were current smokers. And we analyzed the numbers trying to find a confidence interval of 95% or more, and a really and a p-value that was statistically significant. So we could analyze this and provide recommendations to health centers. Next slide, please. In addition, we analyzed 3 other factors, whether or not these patients were living in public housing or HUD-assisted housing, and we compared them to all patients. Next slide. So what we found is that all HUD-assisted people and those living in public housing are more likely to smoke when you compare them to the other population or other that are not living in public housing or HUD-assisted housing. Next slide, please. And it's really interesting to see that even though the percentage of smokers is high, they are trying to stop smoking. HUD-assisted and public housing current smokers, 88% or more say that they are trying to quit smoking. Next slide, please. The desire to stop smoking in the last 12 months was another question, and it was statistically significant to see that those living in public housing and HUD-assisted housing are trying to stop, or they try to stop smoking in the last 12 months. Next slide, please. And there is the comparison here is whether they smoke cigarettes every day. And as you can see as well, those living in HUD-assisted housing and those public housing residents are more likely to smoke cigarettes every single day. Next slide, please. So we think that this is an important issue for all health centers, not only those health centers in or immediately accessible to public housing. Frank in the past has developed a publication on how to establish a smoking cessation program. In case you are not familiar with the publication or you haven't seen the publication, is available in our website, www.nchph.org. And today we are going to hear from Frank about the 10 steps to a successful quit. Good afternoon, Frank.
Good afternoon. Thank you, Dr. Leon. As Dr. Young mentioned, there are also, I think, 8 or 9 other webinars on that website that go into a lot of detail about many of the things that, the background for many of the things I'm going to cover today. So I just wanted to make sure and mention that. Welcome. I'm in Pittsburgh, where right now it's probably about 55 degrees, which is unbelievable for January, and it's raining. So as Dr. Leon said, I'm going to focus today on very practical information that you can use with patients who are ready to quit. And I really want to emphasize those statistics that you just were told about, that most of the people that are in public housing, and in fact, most people who smoke want to quit. So this isn't something that you should be afraid to bring up with the people that you're working with, because most of them want to quit. And this, on any survey that's been done over the last 50 years, you're seeing 70–80% of people say they want to quit. And indeed, a lot of them have tried. The issue is they don't know how to do it correctly. They just kind of sort of try. And as you know, with anything, if you just sort of kind of try it, you usually don't succeed. So what I want to give you today are from my experience, and I've been doing this 38 years now, what everybody needs to do in order to be successful. So we're going to go through these steps one at a time, give you some in-depth information on each one of them. But again, I don't have a lot of time to go into every little detail about everything. So I would really recommend that if you haven't attended any of these webinars that I've done in the past 3 years, they've all been recorded. And you can certainly go into the website and watch those and get much more information about each one of the steps that I'm going to be talking about here. All right, so our objectives, as you know, in any kind of training like this, we have to have objectives. So these are very to the point. You want to identify the essential steps in creating a quit plan. So this is definitely something you want to write down with people. You want to actually articulate. You want them to have a specific plan on what to do step by step by step. If you can't do that, or you don't have the time to do that, or you don't feel that you're qualified to do that, then refer them to your state's quit line. Every state has a quit line. It's 1-800-QUIT-NOW, and that's what those people do. That they're full-time smoking cessation specialists, and they help create quit plans for the individual that calls them. It's free of charge. It's all done over the phone. And in one of the trainings that I do, we go into a lot more detail about that. But the phone number is the same, 1-800-QUIT-NOW. And then you can be the support. You can be the people to help them move it along and make sure that they are staying on track. So you want to work with patients to implement those steps. So once you establish the plan, I would ask that you somehow follow up with them, somehow keep tabs on them. And then I'm going to talk about coping a lot. And this is learning how to deal with the desires, urges, and triggers for a cigarette without having one. Smoking is a learned behavior. Now, I know that may sound like an odd thing to say, but it is. Think about it. Nobody was born a smoker. Everyone had to teach themselves how to smoke. So all we're doing here is teaching them how not to smoke. So it's learning a new behavior. So as in learning anything, you have to have new knowledge, new information, new skills, and you have to practice them. So that's what coping is all about. And it's stuff that you probably already know, but you don't know that you already know. And it's things that you can advise people to do that are very simple, but very powerful. And again, the information, there's a whole booklet on how to conduct cessation counseling with patients, either individually or in groups, that is available. So first off, it's very important that you understand that smoking has 2 parts to it, so quitting has 2 parts to it. Smoking is both a physical addiction to nicotine, and it is indeed an addiction. It meets that definition. And in fact, nicotine is one of the most powerfully addicting drugs in existence. And it's, as importantly, a behavior. It's a habit. So in order to quit successfully, you need to do both of these things simultaneously. You need to use a medication for cessation, and I'll go over those very, very quickly. We do have a full training on all of those, and combine that with a behavior change program. The evidence, there is a publication called the Clinical Practice Guideline for Treating Tobacco Use and Dependence, which is a meta-analysis of over 8,000 research. Plus my own experience, plus all my colleagues, we know that you have to combine these two in order for someone to be successful. I'm going to be focusing on the different aspects of the behavioral change today and what you need to do there. All right, so number one, this I think is very, very important, probably the most important thing that people fail to do, and that is to pick a quit day. You have to quit on a specific day. Now, I want you to think about this like breaking up with someone, okay? Many people who smoke tell us that they taper. You know, they go from like 20 cigarettes a day to 18 to 16 to 15 to 14. And, you know, they try to get little by little, get down there until they get to nothing. Well, think about breaking up with somebody that way. I mean, think about this, you've been with somebody for 5 or 6 years. All of a sudden you decide you don't want to be with them anymore. You can't stand them. You don't want to see them, but you say, okay, we'll go out 5 days this week, 4 days next week, 3 days the following week, and then we'll break up. Now, would that work? I think all of you know, absolutely not. That just, it just isn't the way to do it. It's the same thing with quitting smoking. It doesn't work that way. It's better to end it on a specific day and just say, I'm done, goodbye, it's been fun, but I'm moving on. So it's important that people do this. However, the day they actually do it is very important also. And that is because I don't want you to have them do it when they're in a very stressful time in their life or there's a big change. You want things to be pretty calm and have them prepared to do this. So some days are better than others, but there is no perfect day. So number one, pick that quit day. The day before that, you must get rid of all your cigarettes. No, that is non-negotiable. You can't break up with somebody and still live in the same house with them and think nothing's happened, right? Same thing here. You can't quit smoking and still have the cigarettes in the house. You'll smoke them. I can guarantee you that. I've worked with thousands of people and many of them have tried that. It doesn't work. So advise your client, your patient, to get rid of all their cigarettes. Look under their bed, in their closet, you know, wherever they used to hide cigarettes, get rid of everything. And also they get rid of the ashtrays. You know, many women have little packets they carry the cigarettes in. Anything associated with smoking, you want to get rid of that by the quit day, okay? Because all they do is tempt you to want a cigarette. And I really advise you to tell people to also look in their car, because I know a lot of people think, you know, some of them have fallen under the mats or in between the seats or whatever. And you know, they've quit for a few days and all of a sudden they're in their car and they find that they have there's some cigarettes there. So very, very important steps. Pick a quit day and clean house, get rid of everything. Now, then you want to look at two sides of the same coin here. You want to understand why they want to quit and what's keeping them from quitting. So you want to explore this with the person. What are the motivations that they have for quitting? And it's really important that this be very clear and personal. So many of you would think automatically, well, people are thinking about health. Well, that's not necessarily so. You know, many people know, I would say almost everybody knows that smoking is bad for you, but for whatever reason, their health is not necessarily the most important issue for them. And speaking about health, I don't want you to talk about death. Do not say to somebody, you better quit smoking or you're going to die. Because 99% of people are going to say, well, you got to die of something, right? And guess what? They're right. So this is not about death. It's about living with the consequences of the behavior. My grandfather smoked a lot, and he had a stroke when he was 57 or 58 years old. He laid in bed for 11 years. You know, so I've met people in their 20s who already have emphysema and have to walk around with an oxygen tank for the rest of their life. So the question is, what would it be like if you had to spend the rest of your life in bed because of a stroke? Or how would you feel if you were walking around all day with an oxygen tank? So you really want to focus on the consequence of this behavior to their health, not death. Now, money is a big motivator, and it's becoming more and more of a motivator. As Dr. Leone just showed us, the vast majority of people you're working with are lower income. It's shocking nowadays how much cigarettes cost. Even the ones that you make yourself, or the lower price brands. So in Pennsylvania right now, the average cost of a pack of cigarettes is about $10. I know my colleagues that I do other trainings with at San Francisco, it's $12 to $14. New York, the last time I was in Manhattan, I think they were $15, $16 a pack. And a few years ago, believe this or not, I was in Australia, they're $20 a pack. So the average person right now smoking a pack a day, which is 20 cigarettes, is spending over $3,000 a year on cigarettes. So the question here for the person you're working with is, what did you get for your money? And I really asked that question first to get them thinking, oh, well, all I did was make myself sick, or all I did was burn it up. Then ask them, okay, I'm going to work with you. You're going to quit. You're going to have an extra $3,000, whatever dollars a year. And by the way, I want you to figure out what they are spending individually on cigarettes. And then what could you do with that extra money? $3,000 would buy a nice vacation somewhere, or go a long way to paying for school clothes for your kids, whatever. So money might be a motivator. Family, there's a new baby, a new grandchild, and the parents don't want anybody smoking around the grandchild. Social pressures. It's interesting because when I first started doing this 38 years ago, a lot of people told me that they were having trouble quitting because everybody around them smoked. Now, they're the only ones left smoking, and they have to run outside and hide behind the trash cans to have a cigarette. So the change in our society is having a good effect because it's pressuring people to quit. And then there can be, many, many, many other reasons. I had a woman who one day ran into my office frantic about wanting to quit. She said, Frank, I have to quit right now. And I said, okay, no, you don't understand. I have to do this right now. And I said, oh, calm down, we're fine. What did you do? Did you get some bad news from your doctor? Because my office used to be right in a medical building. And I said, you must have got some bad news about your health. And she looked at me and she said, no, this has nothing to do with me. I'm going to live to be 100. It's poor little Fifi. Now, who's Fifi? Well, Fifi was her dog, right? And Fifi, they had just been to the vets, and this is absolutely true. Dogs and cats and birds can get COPD from being exposed to secondhand smoke. And poor Fifi had COPD. So what did I do with that information? Well, you might be laughing and, oops, hit the button. You might be laughing, but I said, wow, that's a really good reason to quit. I really understand, how important Fifi is to you. We'll definitely do everything we can to help you quit. Sorry, I bumped something there and we went back. So my point of telling you that little story is that anything can be a motivator to quit. So you want to really establish a strong motivation for that person, but even if the person has a very strong motivation, they may have an equally strong barrier that's keeping them. I have a lot of time today to go into these, but I want you to realize that this is equally as important as the motivation. Because as much as you want to increase the motivation, you want to decrease the barriers. You want to get rid of this. And the biggest one you're going to hear from almost everybody is stress. They just are convinced that smoking helps them deal with stress. Well, again, we don't have a lot of time to go into this today, but there is a session on all this that you can get on the website. Smoking causes stress by what it does to the body. It does not get rid of stress. You are getting rid of your own stress. So people need to understand that. If you can have a stress management program at your facility, at your clinic, I would recommend doing that. Or, there are many things out there like meditation classes and yoga, Tai Chi, all kinds of stuff people can do. I would definitely recommend that you suggest that to your the individuals you're working with. Concern about weight gain. I don't hear this so much anymore, but that's still an issue for a lot of people. Again, there is no magic chemical in cigarettes that burns up 50 bazillion calories. If it did, everybody who smoked would look, be this thin and weigh 100 pounds. And they don't, obviously. So again, this has to do with behavior, not with any magic chemical in the product, in the cigarette. Think about this. If you smoke a pack a day, that's 20 cigarettes, you generally take maybe 15, 20, 25 puffs on each cigarette. So you're putting something in your mouth 300, 400, 500 times a day. So that repetition reinforces that behavior. So when you quit smoking, you miss what? The oral gratification. You miss putting something in your mouth. And what's the natural thing to go for? Is food. And not only food, but fatty food, because what we're looking at here with the chemicals in the cigarette, they dull your taste buds so that you really don't taste very well if you smoke. And when you quit smoking, those taste buds wake up and everything tastes incredible. And the one thing that gives food the most taste is fat. So people are not eating celery and radishes and lettuce when they quit smoking. They're eating Snicker bars and cookies and Hostess cupcakes and all the junk they can find. So again, if you did that while you were smoking, you're going to gain weight. So this is a matter of looking at this behaviorally, not from any magic chemical that's in the cigarette. Many people have failed. They've tried to do this and they've convinced themselves because they failed many times that they can't do it. Well, the issue here is not that they can't do it, it's that they don't know how to do it correctly. And I can't tell you how many times I've heard somebody say, well, I've tried a million times and it doesn't work. And I ask them what they did. Well, I put the cigarettes in the freezer so I wouldn't be able to get at them quickly. And I sat around for 2 hours watching TV and I went into, and so what are they doing? They're just sitting there fidgeting, they're thinking about it. So they go run and grab the cigarettes and they smoke. Now, they consider that a quit attempt and that they failed at it. Well, that wasn't a quit attempt. So the way for you to deal with that is to say, you know what, I have had training on this. There's information that I have access to. We are going to set up a quit plan that will work and you will be successful. So don't let their past mistakes stop you from doing this, or rather, and a good point I'd like to make for you is that use that information to help you create the plan now. Past quit attempts are gold mines of information, particularly what didn't work. All right, so you also want to look at, when you're looking at this area, is confidence. So one of the things I always ask people is, you can use a scale, the 1 to 10 scale. How confident are you that you can quit now? And interestingly, what I'd like you to do is to flip what you normally would say. So if somebody says they're a 3, our instinct is to say, oh, no. I don't understand that. Tell me why you think it's a 3. What I'd rather you do is to say, you know what? Based on our conversation, I think you're a 5 or a 6. So it kind of is a sneaky way of increasing their confidence by, by you saying it actually feels more to you than what they're saying, rather than the other way around. And I would ask you to ask this question. What accomplishment in your life are you most proud of? So anybody who's hesitant to do this, anybody that says they don't think they can do this, ask them that question. And no matter what they answer, they may say, I raised 3 kids on my own, I climbed Mount Everest, I paid my way through college. Whatever they say, your next statement is, if you can do that, you can quit smoking. Now, I know you may think, well, that's so simplistic, but it's very, very, very powerful. I can't tell you how many people I've seen go, oh, the light bulb goes up over their head. Oh, wow. Yeah, you're right. That was much harder than quitting smoking. So if I can pay my way through college, if I can raise these 3 kids, I can certainly quit smoking. It's a great way of changing that mindset. All right, then you want to have this person be prepared. So here's where the plan comes in. And you want to look at 3 words: anticipate, plan, and rehearse. So you want to create and write it down. If they need to write it down, write it down. But beforehand, before they quit, know how they're going to deal with a particular situation where they used to smoke. And we'll talk about the coping techniques in a second here. So you want to know what the situations are. So talk to the person. Where did you used to smoke a lot? What cigarette would you miss the most? Questions like that. Then create a plan to deal with those situations without smoking. And then I really mean this, rehearse it. You can act as you can do like role play with the person if they need to. Oh, excuse me. So anticipate, plan, and rehearse. And what you're looking at to teach is coping. So there are 2 types of coping: cognitive and behavioral. So changing what you think and changing what you do. And you can do this before you get in a situation to prevent an urge from happening, or you can employ certain techniques right in the moment to deal with triggers and urges as they're happening. So any successful plan has a bit of all of these in it. So you want to really look at specific situations and then what they can do in those situations. And I have a coping dictionary that I included with the materials that are on the website, so that you can actually look this up if you can't think of anything, or the individual can't think of anything, like while you're in your car, or after a meal, or those kinds of things. It'll tell you specifically what you can do. All right, so let's look at some examples here. Half of the battle here with quitting is what you're telling yourself during the process. And what happens here is that an individual has a thought about a cigarette. So let's say someone has quit and it's the next day, and all of a sudden they're sitting at a table after a meal, and all of a sudden they think, oh, I used to smoke here. So what the person tends to do is they try to make themselves stop thinking about smoking. Now, think about that for a moment. If you try to stop yourself from thinking about something, what happens? Well, you think about it even more, right? So the whole idea here is not to focus on it, not to pay attention to it. Remember, just because you think about something doesn't mean you have to do it, right? Because if everybody on this call, and be honest, if we all did everything we ever thought about in our lives, where would we be right now? Well, we'd either be dead, in jail, or dead in jail. So the very fact that you ever thought about a cigarette is just, it's a learned behavior. So what you really want people to learn here is to say, so what? Who cares? It's not a big deal. Trust me on this. If you can get this across to people, this is half the battle. If they can just say, oh, okay, I'm thinking about it, so what? And move on, those thoughts then become less powerful, they happen less often, and they fade much more quickly. So this gives you some examples. And again, the other trainings give you a lot more examples of things you can say, you know, have a statement ready. I'm proud of myself. I can do this. You know, I'm okay, whatever it is. And then the other thing is to visualize yourself in situations where you used to smoke, but not doing it. So seeing yourself at a party and somebody walks up to you and offers you a cigarette and you say, you can see in your mind's eye, say, no, thank you, I don't smoke. That's an important thing to practice too. I mean, think about it. Most people who smoke for 10, 15, 20 years have never said those words. So practicing it, visualizing it, and many of you may have other other times in your practice where you use visualization or in your personal life. Very powerful, works really, really well. And behavioral techniques. So what can you do differently when you behaviorally, when you have a one of the things I mentioned, like sitting at the table after the meal, it's sitting at the table after the meal that's the trigger. So the moment you're done eating, get up and go brush your teeth, or go take a walk, or go wash the dishes. Break the pattern. Don't do exactly the same thing that you have always done that triggers you to want a cigarette. And if you do that, and what's important here, guys, to remember is that if you do that for 2 or 3 or 4 weeks after you quit, then you've broken the pattern and you've created a new pattern that's not associated with smoking. So leaving the scene, changing the order. We are creatures of habit. So you have somebody who gets up at 7 o'clock in the morning, goes downstairs, put on a pot of coffee, sits and has a cup of coffee and a cigarette, goes up and then takes the shower, and then comes down, has another cup of coffee and a cigarette. That whole routine is tied to wanting a cigarette, being triggered for a cigarette. So what you want to do is change it up. I'm not telling you not to go to work or not to get up or not to get ready, but the moment you get out of bed, jump in the shower or take a bath for a couple of weeks instead of a shower. Have an automatic coffee maker so that when you go downstairs, the coffee's already made. Get a different mug and put the coffee in that. Put the TV on if you never had it on, or turn the radio on if you always had the TV on. Get what I'm doing here is make all these little changes, and then that whole new situation is then connected with not smoking rather than the old situation that is connected with smoking. Deep breathing is a great thing to do, when you have that urge. And you can do that right in the moment. You can do that anywhere. Nobody has to know what you're doing. Leave the scene. You don't have, say you're in a bar and you have an urge, just walk outside. Or if you're having an urge after dinner, go outside. It changes the pattern. So what you want to do is look at a menu of these, have a menu of these behavioral techniques, a menu of these cognitive techniques in your basket to use when you quit. And you want to combine them and do them at the same time. Now, as I said at the beginning, you want to combine these behavior change programs with a medication. I have there's a whole training on these medications. I'm just going to go through them very, very, very quickly here so that you're aware of them. Now, most of you probably are not medical professionals, so you may not feel comfortable with this, but the fact of the matter is that the patch, the gum, and the lozenge are over the counter. You can go into any Walgreens or CVS or Rite Aid, Walmart, wherever, and buy these. And they've been around for 20, 25 years. They're very safe, very effective. So there's nothing wrong with you mentioning their existence to somebody. And then if the person has questions, refer them to a pharmacist. We have trained, my colleagues and I, probably at least 50, 60,000 pharmacists at this point on cessation. So they do know about this. So the first 5 here, the patch, the gum, the lozenge, the inhaler, and the nasal spray, are all nicotine replacements. So they give you nicotine at a slower rate, so you're not getting it to the brain as fast, and at a lower amount. So these are giving you nicotine in a different form, so that is non-addicting. And then you slowly taper yourself off of each one of these as as indicated by the manufacturer. Now, the nicotine inhaler, which looked like a fake cigarette, is not being produced right now. There is a residual supply left out there, so there may be some of them around until the end of 2024. Bupropion and varenicline are two non-nicotine medications. Bupropion is Wellbutrin, which is an antidepressant that works on the dopamine receptors in the brain. Very well tolerated and used a lot. And then varenicline is a medication that's specifically designed to help people quit smoking. It's marketed under the name Chantix. And so right now there are 6 medications out there. Again, be aware of it, advise people to use them. That's an important part of this process, and refer people to their pharmacist to get some more information about this. Now, I've got a few minutes here, so I'm just going to quickly go through each one of these. The patch looks like a big Band-Aid. There are 3 steps, and you take, you go down 21 set, 14-7, use once a day, and it's really very easy to use, very inexpensive. The gum and the lozenge are oral, so the gum looks like a big chiclet, and you have to bite down on that and park it between your cheek and your gum. That has a lot of issues around use. People tend to use this like chewing gum, and that's why it doesn't work. It has a very specific way to use it, and so people have to be taught that, and if they do that, it works fine. The lozenge looks like and then there's a mini that looks like a Tic Tac, and you just suck on that, and you get the nicotine through the buccal membrane in your mouth. And then here's the directions for the gum use. Again, I'm not going to really go through that with you, but that's there for your reference. This is the nasal spray. You spray this directly into your nose, just like Flonase, any of those allergy medications. This is very, very irritating. Most people cannot use it because imagine spraying nicotine right into your nose. It feels like pepper spray. So this has not been very popular. The gum, the lozenge, and the patch are very, very popular, very well tolerated. Bupropion, again, is out there. Now, with the quit day, in the patch, the gum, the lozenge, and the nasal spray, you start that on the day you quit. With bupropion and varenicline, you start that a week or 2 beforehand, because you need to build up a therapeutic level in the blood before it works. But you still have a quit day out there. Again, varenicline is designed specifically for smoking cessation, and more information from the pharmacist on that. Now, the interesting thing is that most people now in formal cessation programs are using combination therapies. So they're using the patch as the base therapy, and then they're adding the gum, the lozenge, or the nasal spray as needed during the day. You can also use the patch with bupropion. So we now, most of the time, recommend combination therapy because we know it works best, and it really gives people a lot of control over their urges. And here are some of the suggestions, again, for your reference. So I know that was very, very short. There is, again, a session on the medications, but I'm guessing most of you are not healthcare providers on this call. I would suggest that you make people aware, send them to their pharmacist. They know what to do and how to counsel people on this. Now, you can be a great support for a person. It's interesting, you will find that many people who smoke still have many other friends who smoke, and many of them are not really happy that this person is quitting, or they're just not supportive, or there's a million different reasons or things that are going on. So you might just be the only person that really is helping this individual quit. So I think it's very important that you realize that, and that you provide a place for them to go and talk. So the idea here is that you provide that role, but you also want the person to find someone at home, someone at work, and someone within their social circle. You may even, if you're at a clinic, create a support group. Right? This would be a great thing. Doesn't have to be a formal program. It could just be almost like an AA meeting where people come together to give each other support. And the whole point of this is to help people work through their feelings, emotions, and issues around this, not to be a policeman. So you do not want a person to get a support person who is going to be calling them every 10 minutes and saying, did you smoke? Are you thinking about it? Whatever. So make sure they're aware of getting a person that really is going to be helpful. There are also online cessation programs. And as I mentioned at the beginning, I would suggest that you refer everybody to your state's quit line. That's an excellent place to get information, to create a plan, and then be support to them all through the process. And realize that this is not something that just happens with one intervention out of the blue. I really think most people need at least a few months of support, a few months of working this in order to stay quit. The quit line, as I said, is free. It is all done over the telephone. Every state has one. Almost all the counselors are master's level clinicians, and you get at least 4 to 6 sessions where they create an individualized program. And what's neat is that many states give away free medication to get started. So they'll give you the patch or the gum or the lozenge for free for a few weeks to get started, and then you can save enough money then to buy your next amount of the medication. Some states have programs to give you, a couple months worth of medication. So just find out what your state has. The counseling is available, I think, probably in 35 or 40 languages. So if your state doesn't have somebody in particular that speaks a particular language, they can refer you to another state and somebody that does speak that language. And there are now programs for people with behavioral health issues, and there are programs for individuals who are pregnant. So lots of stuff, lots of specialties are being developed. It's an excellent source of counseling here and an excellent program. The problem is most patients don't know about it because most clinicians don't know about it because they don't really have money to really advertise it a lot. But again, I can't emphasize that enough that that's who you should refer people to. And finally, I think that this is as important as picking a quit day. Now, you may think this is corny or silly or doesn't make any sense, but I have seen this be very, very powerful. So what I'm talking about here is the need to say goodbye, especially with women. Smoking becomes a relationship. The cigarette is a friend that helps the person through everything in their life. And they really perceive it that way. So as in breaking up with somebody, you need to do something that says it's done, it's over with. It's been fun, but I can live without you. So I really recommend to everybody that they have a quitting ceremony, to do something that's meaningful to them that ends it. Now, all I want you to do is to suggest the idea to somebody. I don't want you to tell somebody what to do because we don't know them that well most of the time. And if this resonates with the person, they will run with it and come up with some really, really interesting things. I literally had a woman who this was many years ago. She was a former Roman Catholic nun, and she had left the convent and now was working here in Pittsburgh and had started smoking when she left the convent, and because she admitted she was very lonely, she didn't have anybody, and she now wanted to quit. She had COPD, knew she needed to quit. So I just said this about a ceremony, and interestingly enough, the week before she was going to do whatever she did, she was a nervous wreck. When she just, I can't do this, it's not going to work, blah, 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 all this stuff that she was telling me. So her quit day was during that next week. She did her quitting ceremony, and then I saw her the following week. She was a different person. Here's what she did. She actually had a funeral. Because she was religious and because that resonated with her, she made a little coffin, put her last pack of cigarettes in the coffin. She went back to the convent where she lived, where she had started smoking. Underneath the window of the room where she started, she dug a hole, put the little coffin in with the cigarettes, put the dirt over it, sang a hymn, said a prayer, and then moved on. Now, I can tell you she was totally different after she did that, because for her, and again, I'm not telling you to tell people to do that, because for a lot of people, they think you're crazy. But for her, it worked. It was a way to say, this was a part of my life, but it's now done. I'm ready to move on. And it let her move on because she put that final finality to it. So that's the whole idea here. People flushed them down the toilet. I had a guy who was a runner it was really starting to affect his running, and he was going to run the marathon in Pittsburgh, which started on one of the bridges. So he took his last pack of cigarettes and threw it into the river. You can do anything, but I really think psychologically what this does is allow the person to be able to say, it's done, it's over with, and then move on. So those are the 10 steps. Just want to end this here. We do have time for questions, so if there is anything, put it in the chat, and Dr. Leone or Fide will be able to let me know what it is. Just finish up here with a few things. So know that these don't work. Quitting cold turkey, yeah, I'm sure you're going to meet a lot of people, especially guys, who say, "Ah, yeah, I don't need any help. I can just do this," and they do, but it's miserable. They go through hell for 3 or 4 weeks, so there's no need for that. I mean, to me, cold turkey is like you breaking your leg and telling the doctor, "I don't need any medication. I'll tough it out." Why? There really is no point to it. The medication's there, use it. All these other things, hypnosis, acupuncture, there's a million things on the internet that have nicotine in them. None of this stuff works, especially and including vaping. So a couple things about vaping. First of all, every one of the techniques that I'm talking to you here can be applied to somebody who wants to stop vaping. So if you have somebody and I think the stats that we looked at, if I remember correctly, like 28% of the population in public housing has vaped at some point during that survey period. All these behavioral techniques work, all the medications work, even though they have not been specifically studied in that population. In the case of vaping, because we don't know how much nicotine is in any of these any of these vaping products, I would start using the highest level and then tapering down. But vaping is not at this point, and I just did a training, or I'm going to do a training for another organization on vaping, so I just looked this all up. The evidence now is not clear. There's not enough evidence to say that vaping actually helps anybody quit smoking. What we're seeing is that individuals who start to vape to quit smoking end up doing both of them. And besides that, they still have all kinds of harmful chemicals in them. And so switching to vape is maybe safer, but it's not really safe. So I ethically cannot suggest to you that you recommend them to people who want to quit smoking at this time. If we did not have 6 medications out there, then I would be telling you something different. But we have 6 medications that have been scrupulously studied. We know they're safe. We know they're effective. So go that route rather than suggesting vaping. So here's that information just that I just told you. Is insufficient evidence to show that there's efficacy, and there's certainly many dangerous chemicals. The chemical that produces the vape, the smoke, is propylene glycol, and propylene glycol is antifreeze. So would you want to put antifreeze into your lungs? So no, again, no, can't recommend that at this point. So to sum this all up, the best way to quit smoking is to combine a cessation medication with a behavior change program. And that behavior change program should include the 10 steps that. So come away with any questions now. I did see something pop up on the chat, so I can look at this. All right, can you talk about which of these recommendations are most applicable to young people, adolescents, and young adults? All right, well, the only thing that's really different, or the main thing that's really different, is motivation. So these kids have just started smoking, so they're not really probably thinking about weight gain or family issues. And so you really want to look at what is pertinent to them. Now, so two things. We know that smoking affects the skin. So for young ladies, you really focus on looks and how it can cause fine lines, it can cause wrinkles. There is a computer program that actually ages people. I think they use it for in cosmetic counters to show people what they look like if they have certain makeup on or different hair color, that kind of thing. So I was on a TV show where they brought in a young lady and they did this, who smoked. They aged her 10 years. She fell apart on screen. It was fantastic television, I have to admit, once she saw herself. So I would look at that. I would look at how it affects your dating life. Are boys going to want to go out with you if you smell? With guys, honestly, the best thing, we know that smoking affects sexual function. So if without going into a lot of detail, all of that that works down there depends on blood flow. And we know that all the chemicals in the cigarettes constrict blood flow so that men who smoke don't function this way they should, and as well as other, or as well as men who don't smoke. So honestly, those are the tactics I take. And sports, you are really letting your team down if you smoke because you're not able to breathe as well as you should. I have worked with plenty of kids who've already, after just a year or two of smoking, if you do pulmonary function testing on them, they are below what they should be. And interesting enough, I just saw on the internet yesterday that a 22-year-old kid got some kind of lung disease from vaping, and they had to do a double lung transplant. So it can affect you when you're young. I worked with a girl who was 26 and she had COPD already. So you're not immune. So those are the things that I would look at, how it's affecting their social life, their looks, sexual functioning, and team sports. And then for someone who's currently unhoused, that's that's very complicated. But just in general, they can quit. It's a little more complicated, I think. But here again, you want to look at what are the motivations, what's keeping them from quitting, where are they getting the money? Can they be using that money for other things? What's the barrier? Are they just around everybody else who smokes? And you may have to prioritize a lot of the other issues before you get to helping them quit smoking. So just like somebody who has psychiatric issues or is using drugs or alcohol, you've got to stabilize the person first and then help them quit smoking. You can't really do that, a smoking cessation program, in the midst of a drinking binge or if they're high on drugs. So it's not a matter that they can't do it. It's a matter of where in the process you put the treatment. So hopefully that helps a bit.
Thank you, Frank. That
You're
was
welcome.
a great presentation. I think that we are running out of time, so
Okay.
I don't see any other questions. If you still have questions, you can direct your question to Frank. He is sharing his email address as well as his telephone number, or you can contact any of the NCHPH members, and we'll be glad to help you with any questions that you have. Before you go, please make sure that you complete the survey, and we have some additional resources here. In addition to all the resources that Frank mentioned that are available on the NCHPH website, we have probably 10 or more resources on our website. So please make sure that you also go to the NCHPH website and check the resources that Frank mentioned. Please complete your post-evaluation survey. And if you have any questions, our contact information is here, so you can contact any of the staff members and we'll be glad to help you, or redirect any question to Frank that is related to this topic. Thank you so much and have a great afternoon.
Thank you, everybody. Thank you, Dr. Leon. Bye-bye.